Okay, the Board of Direct Entry Midwifery meeting is convening at 8:03 a.m. on May 29th, 2025. This meeting is held in person through MS Teams video conference and is being recorded. The recording will be posted to the internet for public viewing. I will now call roll. Meredith Mance, here. Lennon Clark.
Here.
Rebecca Fisher.
Here.
Meredith Klein. Christy Morales.
Here.
Lynette Pettibone.
Here.
Misha Ronick.
Here.
Members, when you wish to speak, please state your last name for the record. Board members are asked to not use the chat feature during meetings. The Health Licensing Office asks that individuals attending through MS Teams keep their phones muted and cameras off during the entire meeting or until they are given the opportunity to comment during the public and interested parties feedback period, if indicated on the agenda. Public comment is limited to matters listed on the meeting agenda or topics relevant to what the board has statutory authority to regulate. Public members wishing to speak, please sign in on the roster sheet available in the room or email Josh Page at josh.page@oha.oregon.gov and provide your first and last name. Everyone is asked to use appropriate language, manners, and protocols when conducting board business. Okay, our first order of business is to approve the agenda. And okay.
This is Lynette Pettibone, and I motion to approve the agenda.
Great. We have a motion. Do we have a second?
This is Christine. I second.
All right. A motion has been made and seconded. I will call for a vote. Meredith Mance. Aye. Lennon Clark.
Aye.
Rebecca Fisher.
Aye.
Christy Morales.
Aye.
Lynette Pettibone.
Aye.
Misha Ronick.
Aye.
Wonderful. All right. The agenda has been approved. So we will move to public and interested parties feedback first today.
This is Meredith Klein. I'll just tell you I joined also.
Awesome. Meredith Klein is now here at 8:06. So we are set. At this time, the Board of Direct Entry Midwifery will hear public and interested parties' feedback. Public comment is limited to matters listed on the meeting agenda or topics relevant to what this board has statutory authority to regulate. Comments will be limited to 3 minutes and will not be allowed if they are disruptive to the board's conduct of its business. If you are called on to comment, HLO staff will request the public member to unmute themselves. The chairperson and HLO reserve the right to end a person's comment early and have HLO staff mute the public member if the comment does not pertain to matters listed on the meeting agenda or topics relevant to what this board has statutory authority to regulate. Are there any members of the public who wish to comment? If so, please raise your hand or use the MS Teams raise hand feature and wait to be acknowledged. Okay. I'm not seeing any hands raised. HLO, can you confirm that?
Yep, I didn't get any emails or anything, and there's no hands raised. There's 2 members of the public here, but they'll be raising their hand.
All right. Then if there are no public comments at this time, then we will switch to item number 4, which is executive session. So bear with me, doing a little script juggling here. The Board of Direct Entry Midwifery will now meet in executive session pursuant to ORS 192.6602F and ORS 676.595 for the purpose of considering information or records that are exempt by law from public disclosure at 8:09 a.m. on May 29th, 2025. Representatives of the news media shall be allowed to attend the executive session. Audience members attending through MS Teams will now be moved into a separate breakout room, and audience members attending in person are asked to leave the room both for the duration of executive session. Those authorized to attend the executive session, please continue to keep your phone muted and camera off. Are there any representatives of the news media on MS Teams? Recognizing there is no news media in attendance, the public will be moved into a separate breakout room for the duration of the executive session. We will return to open session before taking any final action or making any final decisions. It is estimated that the board will return to public session at 8:30 a.m. Please be aware it is possible that the board's executive session may last longer than 8:30 a.m. If the public has any questions about whether the board is still in executive session, then the public can contact Josh Page at josh.page@oha.oregon.gov. All right, the Board of Direct Entry Midwifery will now exit executive session and reconvene open session at 8:55 a.m. No final decisions were made and no votes were taken in executive session. The public will be moved from the breakout room back into the meeting, and representatives of the media may once again report all board discussions and actions. That takes us to agenda item number 7, which is a board motion and vote. Do we have any motions?
Yes, this is Lynette Pettibone, and in case number 20-9507, I move to offer a settlement agreement and delegate to the chair the ability to approve the final written terms.
Okay. Motion has been made. Do we have a second?
This is Lennon Clark. I second.
All right, a motion has been made and seconded. I will now call for a vote. Meredith Mance, aye. Lennon Clark,
Aye.
Rebecca Fisher, Rebecca, are you still here?
Yeah, I'm sorry, technical difficulties. Aye, my vote is aye.
Meredith Klein,
Aye.
Christy Morales,
Aye.
Lynette Pettibone,
Aye.
Misha Ronick.
Aye.
All right, the motion passes. Do we have any other motions? Okay, and just confirming before I start reading scripts, we are moving to executive session again. Is number 8 something we are still discussing? Is that still on the agenda?
Yes.
Okay, great. All right, so the Board of Direct Entry Midwifery will now leave the public meeting pursuant to ORS 192.6901B to deliberate on a contested case at 8:57 a.m. on May 29th, 2025. The deliberation will not be recorded and no final decisions will be made. Do we have a time estimate for this?
20 minutes.
All right, though we are estimated to return at, let's call it 9:17 a.m. The Board of Direct Entry Midwifery will now reconvene open session at 9:22 a.m. No final decisions were made and no votes were taken. The public will be moved back from the breakout room and representatives of the media may once again report all board discussions and actions. All right. So do we have, that takes us to 10, just confirming, do we have any board motions to make? All right, and it sounds like 11 and 12 are not applicable to today's meeting, so we are moving to number 13 on the agenda, which is executive session. The Board of Direct Entry Midwifery will now meet in executive session pursuant to ORS 192.6602F and ORS 676.595 for the purpose of considering information or records that are exempt by law from public disclosure at 9:23 a.m. on May 29th, 2025. Representatives of the news media shall be allowed to attend the executive session. Audience members attending through MS Teams will now be moved into a separate breakout room, and audience members attending in person are asked to leave the room both for the duration of executive session. Those authorized to attend the executive session, please continue to keep your phone muted and camera off. Are there any representatives of the news media on MS Teams? Recognizing there's no news media in attendance, the public will be moved into a separate breakout room for the duration of the executive session. We will return to open session before taking any final action or making any final decisions. It is estimated that the board will return to public session at, what's our thoughts?
30 minutes.
Okay. Oh, it is estimated that the board will return to a public session at, we'll call it 9:55 a.m. Please be aware that it is possible that the board's executive session may last longer than 9:55 a.m. If the public has any questions about whether the board is still in executive session, the public can contact Josh Page at josh.page@oha.oregon.gov. All right. The Board of Direct Entry Midwifery will now exit executive session and reconvene open session at 10:13 a.m. No final decisions were made and no votes were taken in executive session. The public will be moved from the breakout room back into the meeting, and representatives of the media may once again report all board discussions and actions. All right. That brings us to number 15, which is any board motions or votes.
Yes, this is Lynette Pettibone, and in case number 24-11172, I move to close without action.
Okay, a motion has been made. Do we have a second?
This is Misha Ronick. I second.
Okay, I will now call for a vote. Meredith Mance, aye. Lennon Clark,
Aye.
Rebecca Fisher,
Aye.
Meredith Klein,
Aye.
Christy Morales,
Aye.
Lynette Pettibone,
Aye.
Misha Ronick.
Aye.
All right, the motion passes. Do we have any others?
Yes. And again, this is Lynette Pettibone, and in case number 25-11364 and 25-11356, I move to open an investigation.
All right, do we have a second?
This is Rebecca Fisher and I second.
All right. I will now call for a vote. Meredith Mance, aye. Lennon Clark,
Aye.
Rebecca Fisher,
Aye.
Meredith Klein,
Aye.
Christy Morales,
Aye.
Lynette Pettibone,
Aye.
Misha Ronick.
Aye.
All right, the motion passes. Do we have any others?
Yes. And again, Lynette Pettibone, and one last motion from me. In case number 25-11355 and 25-11363, I move to close and refer to case number 25-11307.
All right, a motion has been made. Do we have a second?
This is Christine. I second.
All right, I will now call for a vote. Meredith Mance, aye. Lennon Clark,
Aye.
Rebecca Fisher,
Aye.
Meredith Klein,
Aye.
Christy Morales,
Aye.
Lynette Pettibone,
Aye.
Misha Ronick.
Aye.
All right, the motion passes. And any additional actions?
This is Heather Vogelsong. I just wanted to clarify, Trampus, was that case number in that last motion 25-111307? Were there 3 ones in there?
Which one? I'm sorry.
It is, there was a motion to close 25-11363 and 25-11355 and refer to case number 25-11307. And I'm wondering whether there should be 3 ones that the case is being referred to.
Oh, yeah, hold on. Let me verify.
In the case summary, there isn't, but that doesn't mean there's not a typo there as well.
Thanks, Lynette.
Mm-hmm.
Just get 1 second. I just got to get back to that document. So
Just have a lot of ones in the other current cases. So
I am the system as well, because it's 2 ones on the and that looks like the right number of numbers.
thank you for clarifying that.
So it's 11307. Yes, it's 11307, 2 ones, 307.
Thank you.
Right.
All right. Thank you for clarifying. So that takes us to number 16.
So this is an update from the last board meeting that we had regarding the courses in case number 19-9369. Just as a reminder, there were some two courses submitted for board approval. One of them the board approved, the other one they delegated that approval pending, additional information from the respondent. I asked for additional information. That information was provided to the delegee, who was Lynette Pettibone. She reviewed that. It turns out after reviewing that, that class that was submitted didn't fit in with what the board was asking for in the settlement agreement. So that was denied. That particular class was denied, and the respondent was informed of that decision and given the opportunity to supply a new class. The new class, I have not gotten a new class submitted. There was not a new class submitted by the respondent to me to bring to this board meeting. So that possible items for board action approval of courses, I do not have additional ones. Although it was indicated to me that the respondent was having a hard time finding a class that would fit the board's requirement. So that was the last I had from that. That's what the information is basically. That's the update for that situation. That's, I don't know if there's any discussion that the board wants to have around that. I will reach out again to the respondent just to give them another. And I'm open to them contacting me as well. So.
Okay. Does anybody have anything to add to that? Otherwise, it sounds like Trampus is on it. Okay,
So
let's
that's
move to number 17, which is the Rules Advisory Committee item.
Hello, this is Sammy. And so just wanted to get your guys' feedback on making sure that we hit all the marks with the persons and communities likely to be affected by the rule changes. So we received 9 interest forms, and they're self-identity specific. So somebody can say that they're a veteran, and we don't check that stuff. I have met with Amelia Smith last week and kind of went over what membership we have and what I thought we might still need. So she's reaching out. Chrissy also has reached out to the Oregon Pharmacy Board to see if maybe there's a pharmacist or a pharmacy technician that might be interested to serve. So we've done, and that should be going out today or tomorrow. Basically a memo saying we would like, is there anybody interested? So just to kind of briefly go over who we received. We received a consumer. Well, some of these can be multiple people serving in these roles, and one person could serve multiple roles. So we have consumer covered, LGBTQ queer community covered, low income communities covered, a host of healthcare professionals, LDMs, CPMs. We have 1 OBGYN and 1 paramedic. We have a healthcare professional that serves the LGBTQ community, small business owners, a few birth center representatives, rural community reps, NARM preceptor, an OMC representative, fire service and emergency medicine representative, indigenous community representative, veteran community representative, and educators. So kind of how you can determine if we've met them all is who will the rules affect. So midwives mostly, and what they can do, how they're going to learn legend, drugs, and devices, and what the supervisor is going to teach them, and how that's going to roll out in the competencies. who are the usual stakeholders. So same answer, I think. Consider additional groups that may be unified by a common characteristic. It's kind of everything's covered. The only thing I could think is maybe like an insurance provider, but I don't know how effective they would. Well, obviously, a pharmacist would be great, or a pharmacy technician. So it's really up to you guys to determine if we've covered everything. The only other thing that I thought might be helpful is somebody kind of in the BIPOC community, because I only got one application for an Indigenous person. Nobody else self-identified of any other thing, any other ethnicity.
That does sound like improvement from the last time, though. So definitely progress.
Yes. And I reached out to all the places that I showed you at the last meeting. I am going to try and reach out to the Oregon Perinatal Collaborative to see if they have anybody. But it's kind of hard, it's hit and miss if you get anybody that even opens the email, really.
Okay, well, we are headed in the right direction, at least. I know I've been trying to single out and recruit people to reach out to you.
Yeah, I think Amelia's going to, our meeting was really, really great last week, and she's working on it, getting somebody who would have fit in the BIPOC community lane. So she's determined, she said. So, and then maybe we'll get a pharmacist or pharmacy technician. I don't know. We'll see.
Great. All right. Well, thank you for the update. Does anyone have any questions for Sammy?
Oh, and 3 of the qualification committee members are going to jump over to the Rules Advisory Committee. It's Colleen Forbes, Holly Scholas, I think maybe Julia Bailey. I can't remember her name. So they're going to jump over. So they're already on, just so we can keep some consistency and cohesiveness, and they can answer questions as to why they did this or that. So there's that too.
Great.
So once I get the that from Amelia and we get somebody, me and Josh will schedule the meetings and we'll start. I'm hoping to start the meetings in July.
Awesome. Thank you, Sammy.
Yep, no problem.
All right, so that brings us to number 18, other board business. Does anybody have anything to add?
This is Meredith Klein. I think technically my term ends in June. So I guess I wonder if there's any new applications.
Hi, this is Christy. No, we don't have any new applications at the moment, but I do go through them once a month just to kind of make sure that we don't have any pending applications. But if you have anyone that you'd like to maybe recommend, send them my way.
So I know in the past we've had an option where in order to leave not an empty, unfilled seat, we've had or asked the person whose term is expiring to stay until another person is willing. Is that something we're able to do? I know we did that with Wendy previously, and I think Kelsey even. So I guess it's a 2-part question for HLL. Like, is that still something we can do until that seat is filled? And then for Meredith, is that something you would be willing to do?
Yeah, I mean, I'd be willing to stay for like a couple more meetings, and there's so much that's like pending right now. I kind of want to see it through.
Yeah,
So
we
HLO
can totally keep you guys on if serving till replace. That's usually what we call it. So if that's the plan, I will mark that as serving until replace until we can find a replacement. That'll be pretty easy.
Awesome.
This is Lennon Clark, and I actually know a licensed direct-entry midwife that's applied, and she thought her application had gone through. So who should she contact about that if you guys don't see that on your side.
That would be great. If you could send them my way, I can give you my email address. It's chrissy.pickett@oha.oregon.gov. And I can reach out to you separately, Lennon, if you'd like me to give you that email as well.
Yeah, thanks.
All right, thanks.
Thank you, Meredith, for being flexible in the meantime.
Sure.
Do we have any other board business to discuss? Okay, not hearing anything. So in that case, I believe we have done the thing. So our next meeting is July 9th.
Yes.
Great. Okay, the Board of Direct Entry Midwifery meeting is adjourned at 10:29 a.m. All right,
Nope,
everybody.
it's Meredith, it's July 10th. I'm sorry.
Sorry, July 10th, whatever that
Yes.
Thursday.
I was like, oh no, I better check that.